researching into a diagnostic test for male infertility. You may know that 1 in 6 couples are infertile during their childbearing years, so it's a very big problem. And up until now, we've had very poor tests to actually diagnose male infertility because most of the focus has been on the woman. And we have developed a second generation DNA test so that we can diagnose the problem that men have, and also we can predict how successful they'll be with infertility treatment. I've been working in the area of infertility for about 20 years, and we've been working particularly in the area of DNA and the damage that can be done to DNA by all the lifestyle factors and the way we live our lives in the Western world. And it's really just over the last 4 years that we've been able to translate the research that we did in the lab to something which will really be beneficial for society. We focused on men because there had been so little done there. Many people have studied women. Childbearing was always a woman's issue. But actually 40% of the problems with infertile couples are dependent on the man. And so it's an area where very little had been done, and one which we in Queen's saw the opportunity, grasped it, and now we have made a very substantial inroads into solving the problem. We're going to be able to help couples to find out what their problem is faster, and then we're going to be able to direct them to the best treatment. It'll be a bespoke treatment, it will be tailored for their particular needs, and of course this will save them time. Time is so important. As the woman gets older, her chances of having a baby are less. So if we can speed up the time from their diagnosis to treatment, that will be great for them. It will cost less money, and it will save some of the awful heartache that these couples have in having failed treatment and never having the family that they want so much. When we had developed the tests and the papers were published, one was published in Fertility and Sterility, which is the top journal in America, another one in Human Reproduction, which is the top journal here in the UK. Reuters picked up the results, and then I found that lots of couples were emailing me and asking me if they could have the tests. At that stage we hadn't actually thought about commercialising the test, but when we realised that this was an opportunity and in fact a responsibility to translate our benchwork to society, we went to Cubus in Queen's and asked them if they would help us to set up a spin-out company, and they were very supportive, very helpful, and we managed to do that within a year. So now the company is up and running. We're working with the fertility clinics and with the doctors involved there. The fertility clinic will send the men's sperm samples to us, and we will analyse them and see how much DNA damage there is and have the results back with the fertility clinic within 7 days. So it's a very fast turnaround. There are many challenges when you're working on human subjects because there's so much variability between couples, and of course getting people involved in research when this is a very traumatic time clinically for them. So it took a long time to get enough people into the studies to develop sound, scientifically based studies where we would have robust clinical outcomes. What allowed us to really overcome the difficulties was tenacity, just keeping at it. We were also very lucky to be in the Centre for Public Health in the School of Medicine here in Queen's, and a very supportive line manager who was able to see the possibilities in what we were doing. We tried again and again to get external funding, and I'm very glad to say that we now have the first Framework 7 funding from Europe in male reproduction, and this is very exciting for us. We've also got other substantial funding from the NIHR here in the UK. So the future is bright. We are doing collaborative research now with others all over Europe, and we're hoping that we will really be able to move forward in this area of male infertility and how to solve it within the next decade.